Hi, everyone, and welcome to From Print to Pod. I have with me Dr. David Epstein, who has written the article, When Yelp Becomes a Source of Anxiety. And we are going to be asking you a few questions based on that article. But before we do that, Dr. Epstein, can you just quickly tell us a little bit about yourself?
Oh, great. Thank you so much, Donna. It's great to be here. Um, I am a pediatric intensivist and I specialize in cardiac intensive care. I'm the director of the pediatric and congenital cardiac intensive care unit at Guerin Children's at Cedars-Sinai Medical Center in Los Angeles.
Okay, sorry about that. Um, so, what inspired you to write about the anxiety induced by online reviews like those on Yelp?
It's interesting. So as you and maybe some of the audience knows that my wife and I built an urgent care a number of years ago, and we came from academic institutions, and then we went into the business world, entrepreneurial stuff, and then you're exposed to these interactions with customers. Basically, it's medicine is a service industry to a great extent. And so we're on the front lines and we're serving our community. And we have people who are happy with the services that we deliver, and we have some people that are not so happy with the services we deliver. But one of the sources of great anxiety for us as business owners or small business owners was that we would get Yelp reviews. And we didn't necessarily understand Yelp when it started, but then as we built our business and they started coming in, it would be great. Oh my God, we got a great review. They really enjoyed what what we were doing. But then sometimes we get a bad review, and we were like, "What happened? Why did they say that? What was the story behind that?" And it was interesting. A lot of times we would realize who it was, and then we would speak with them. We'd call them and we'd talk to them and see what happened, and we do what was called like a little service recovery, but really taking their comments to heart because we wanted to make our business better. But we found out over time, when we get those notifications that there was a Yelp review coming in, before we even opened it, my wife and I were just like, our hearts would just be like, we'd have this stress response because it was like, is it going to be good or is it going to be bad? If it's bad, then we have to do all these things to kind of do service recovery and explain and work with this. You know, and it's not that we didn't want to improve our business, but the fact that Yelp had such an impact on our business as a small business, because people would look at those Yelp reviews and determine if they wanted to patronize our institution or our facility or not. And it was, we were seeing, like ourselves, like, oh, well, we're not going to go to this restaurant. They only have 3 stars, or we're not going to go to this other place because, they had a bad review. So we found ourselves in the same situation. And so I think that really brought out a lot of anxiety. And in the end, when we actually were acquired and the business was no longer ours, I think it was a great uh, feeling of relief. It was like a weight off our shoulders. But it made me realize an important thing is that Yelp, it it brought out some good things in people, but it also brought out some bad things in people. And the things that I related to is the sometimes the anonymity of saying something as a kind of like a personal attack or getting getting a jab in or attacking without really giving the other person time to respond. The stakes are high in a small business and the impact is high. So if you're going to post a bad review, why didn't you just talk to us first? And maybe we can remedy that. And maybe we can do some things to make things better. And we're always trying to do the best for our clients. But then, I think the important thing was that when I went back into academics, I realized that the same thing happened in academics where if somebody wasn't happy with something, now in a lot of academic institutions, they have reporting systems where anybody can write anything about anybody if something was worth reporting. like if somebody raised their voice at a colleague, or they made a mistake, or there was a bad outcome. They have all these reporting mechanisms, which I think are a good thing. But when it comes to interpersonal interactions, wouldn't it be better to talk to that person before you just report them? And that's kind of why I wrote the article, because it seemed like some of the interactions that we're having on an institutional level now are like those bad Yelp reviews. And I saw a correlation. And, you know, it's not a good feeling when we lose that interpersonal piece, where you can't just talk to somebody and talk through something like, hey, I didn't really appreciate the way you spoke to me, or what, I think that if you did this better, maybe you can change this way you do it, you can do this better next time. Instead, sometimes, even though they're not termed as punitive, sometimes they can feel that way. So sorry, that's a long-winded answer, but that was kind of like the build up to me writing the article, because that's the way I kind of feel sometimes how things
No,
are.
it
And
makes complete sense. And actually, wouldn't you say, or would you say that a healthcare visit anyway has so many variables to it that I don't know, it's in a different ballpark than when you're rating a restaurant. Can we talk about that for a second?
yeah, I mean, you know, I I think that there are a lot of different variables, but my feeling is that when you break it down to the bare bones kind of thing, it's just the human interaction part. And that, I think, that's the piece with that kind of triggers me the most, is because I think, yes, the stakes are higher in healthcare, and there could be, life and death situations, or morbidities that can occur from bad decisions or bad interactions or whatnot. But at the end of the day, I would just like people to sit down and say, hey, let's, maybe we could talk through this, and maybe there are people, like there are healthcare providers, physicians, nurse practitioners, PAs, nurses, pharmacists, along the line, who don't want to talk, you know, to their clientele. And yeah, that's probably a problem. But then you have on the other side where the clientele have an issue, and they don't want to talk or bring it up to their healthcare team. So I think that's the important part, where kind of Yelp in itself, it kind of represented that piece in our community, that people should talk to each other and not just be so reactive in a way, and just sit down and just connect.
I think it may simplify the healthcare visit. And just to be a little bit more specific about what I meant by the variables, is just that when you go to a restaurant, you're going to a restaurant, you're getting seated, you're ordering, and you're eating, right? There's variables there as well. But in a healthcare visit, there's more than just making the appointment and coming in, and you're now talking to a secretary, usually the front desk staff, so you have to deal with them. Then you have to deal with a VA who's doing your intake. There might be a nurse that's maybe drawing your blood. The doctor is a small part of that. There's also the after parts. There's the billing, and there's the insurance companies, and there's the denials, and there's the prior authorizations. What I kind of mean to say is, do you not agree that there is so much more to healthcare visits that is a lot of times not in the hands of the doctor, but may seem like it is more in the hands of us? Maybe less so when you were owning the urgent care, because it really was your business. Maybe more when we're working for someone else, and someone yelps us personally as a physician. What are your thoughts on that?
Yeah, no, that's a good point. I think the level of complexity is greater, and that's not to say that, restaurateurs, I mean, their business is
Very important.
very important, very amazing, and there are complexities there. But knowing medicine and how there are a lot of variables involved, like you mentioned, that if something is off in one thing, it can delay care, or it can create a complication. I mean, we always hear about somebody who the insurance a, denied their pre-authorization to get a medication, and so now the medication that they need gets, the timing gets bumped off, and they have to spend hours on the phone. And so there are lots of points in healthcare where there are opportunities for dissatisfied, uh, for somebody to be dissatisfied, um, and maybe I'm focusing on those interactions with like, the one-on-one interactions with the doctor or the person or the nurse or things like that. And I think on a human level, uh, I think people have just become very reactive instead of approaching it and discussing it. They react by posting a Yelp review and instead of looking into the problem or asking questions. And yes, I could understand if somebody doesn't respond appropriately or gives the brush off and doesn't want to listen. um, and that's a different thing. But if somebody's willing to listen and somebody's willing to talk through it, I think we should take advantage of that because I think it will make things, the relationship stronger. And I think people will get more out of the visit. But yeah, I mean, I agree with you. Like when healthcare, there's so many things that maybe are beyond the control of the doctor, and there are a lot of things that can be dissatisfiers along the way, and the doctor may be blamed for them, uh, when it may not necessarily be their fault in that arena.
Do you believe the fear of negative reviews influences clinical decision making?
That's a good, that's huge. I do think that the way we see people reacting to anything that we do does affect our decision making to some extent. Like for instance, you have a family that their child has ear pain and they really feel like there's an ear infection. You examine them, there's no ear infection, and but they're very convinced and they're getting upset that their child needs antibiotics. Well, their child doesn't need antibiotics because there's no ear infection. So how do you navigate that? Because at the end of that visit that they're going to be upset. And if by some chance they go to some other practitioner, okay, and that person says, "Oh, yes, you have an ear infection. I'm going to give you antibiotics." They're going to come right back and say, you know, "You were wrong. This person was right." And you don't know, things can change in medicine. There can be an ear infection, a day after you didn't see an ear infection. Things can change very quickly, but then you're blamed as, you're saying, okay, you're negligent, you're incompetent, and so there's a lot of that. In the institutional, world, in the ICU, there are families of different medical literacy, and sometimes there are families that may be pushing, their agenda on certain things because their knowledge base is better, and they may direct care a little bit more than maybe a family who's not as medically literate or who may not have as strong beliefs about the care of their child in certain ways. So I think there are external forces, whether it be concern for Yelp or concern for parents' reaction to how a parent is educated, how they know their child. They may be able to direct care a little bit more than another family. So I think, yeah, long story short, to your answer to your question is that yes, I mean, I think those outside influences do affect how we care for our patients to some extent.
So here's a question that's totally up our alley here is with the rise of social media and online platforms, how should physicians manage their digital presence?
Mm, yes. Um, yeah. I think, we I know you've been at it a lot longer than I, um, and you have a lot more expertise. Being at it a number of years and seeing, the landscape out there and seeing, a lot of the misinformation, um, and seeing how you hold yourself, I've learned over time, I think, is you can't, I mean, obviously, if patients are responding to you on Yelp, that's one thing. If somebody's attacking you on social media, for care that you've delivered or things like that. I think that's another thing that can be quite sensitive. But most of the things that we experience as physicians on social media is when we post something that's medically factual or supporting something, let's say, vaccines or public health policies or things like that, that it may be politically charged, maybe conspiratorially charged, maybe misinformation charged, that we do get attacked on social media. And I think that one thing that I uh, I guess evolved over time as a physician is just posting my stuff, the information which I know is factual, and then if somebody's responding or attacking, is really just ignoring that, or just saying your comment is inaccurate, and not trying to kind of create this battle back and forth. Because I think there are a lot of people, or they call them trolls, I guess you would say, who are out there who are trying to kind of feed um, the dissension, amongst the population, and trying to get likes and things like that. I think all we can do is just be ourselves and be true to our mission, our goals, as physicians.
Yeah, I couldn't agree with you more. It's very complicated to navigate that and to balance it as well.
Mhm.
So, do you think that there should be guidelines or some regulations that govern patient reviews on public platforms?
Yeah, I mean, it's as a clinician, yes. As a person, I don't know how that would be possible. Um, I remember we would get Yelp reviews, and we're like, that there's no way that this patient was seen at our clinic. We have no record of somebody like this or this or that, and it was like malicious or something. Um, and you can't do anything about it on Yelp because they don't, they stay up, even if you argue that, unless the patient, like, hey, we were opened in May, and this review is from April, so there's no way we could have been reviewed in April because we weren't even open yet, kind of thing. So, but it's very hard in the medical arena because we have to adhere to HIPAA, which means, we can't call out, a patient saying, "Oh, you responded and said, well, when I examined your son, Johnny, and, he had an ear infection, and, we tried this antibiotic and it didn't work, and you wanted more." We can't give that personal narrative. We're kind of like, our hands are tied behind our backs. And so, I would love to say that, the discourse should be limited, um, because we can't necessarily respond appropriately. Um, all we can respond in those Yelp. I mean, I've seen the canned responses for negative Yelp reviews. It's like, I'm sorry, we're sorry that you didn't have a good visit. We pride ourselves on delivering the best care, um, but sometimes that isn't always the case. And please feel free to reach out to us, and we can talk about this further. That's like the canned response on Yelp from any clinician, because you can't go into those specifics or those details because HIPAA prevents us from doing that, and we can't tell them that you were wrong because of X, Y, and Z.
Right. It definitely sets up a different playing field. And so
Yeah,
it's not it's not apples to apples, it's apples to oranges sometimes. Right.
100%,
Yeah.
100%.
Yeah. Okay. So for the sake of keeping this episode short,
Yes.
I will close up the session because we got some great conversation in where it came to um, physician reviews. So, thank you so much for writing the article. It's such a necessary conversation. Thank you for joining. Anything you want to leave the audience with, either personally speaking or about this topic?
Thank you. Thanks for inviting me on. This is a wonderful experience, and you do a great job on your platform and bringing us all together. I think the one thing I'd like to leave people with is that, if you have an issue with somebody, whether it's on Yelp, or like a small business, it doesn't have to be medicine, it could be anything. Or if you're in an institution that has a reporting mechanism, instead of just reporting somebody personally, or or attacking them on social media for something, or Yelp for something that you feel you were wronged in some way, have the take the opportunity to talk to that person or that institution or that the owner of the business, or see what's going on, because your comments can actually land a lot better if that person is able to listen and take your comments into to heart, if they're listening. And I think that that's the key, is that we have to listen to each other, but I don't think that we should be afraid of having that person to person discourse instead of that more anonymous, post and attack, um, just because it's that medium is available to us. So I think that human connection can solve a lot of problems.
And with that, we will close this episode. Thank you, Dr. Epstein, for joining.
Thank you, Dr. Cordell.